Well, ladies, how many of you think, oh, you know what? I've been eating right, I'm exercising, but yet I still can't lose weight. Maybe you've got these mystery symptoms that no practitioner or doctor seems to be able to figure out. You might be super tired, you could have skin rashes, foggy brain, acne. There's so many different, like little tiny unexplained symptoms. Hair loss, another big one that I hear all the time, insomnia, whatever it might be. Could it be toxins? And I really, in the last couple of years, have dug into the research of the amount of toxins that are in our environment right now. And it's crazy how much is in there. I don't think any of us are exempt from being exposed to these things anymore. And it really comes down to, can your body detoxify these things? So my guest today is an expert on this, of course, Wendie Trubow, MD, MBA, is a functional medicine gynecologist. She received her MD from Tufts University in 2000 and has been practicing functional medicine since 2009. After all these years, she is still passionate about helping women optimize their health and their lives. There are so many different challenges in a woman's life. We all know this: work, home, relationships, spirituality, health, and they all matter. While her credentials allow Trubo a solid medical backdrop to help women achieve vitality, her own health journey has also inspired and supported her methods of care. Through her struggles with mold and metal toxicity, celiac disease, and a variety of other health issues, Trubo has developed a deep sense of compassion for what her patients are facing. When she's not helping patients in her practice, which is called Five Journeys, you can find her alongside her husband and their four kids, creating a beautiful ecosystem in their yard that provides nourishment to both body and soul. She co-authored the book Dirty Girl: Ditch the Toxins, Look Great, and Feel Freaking Amazing, which became an Amazon bestseller in 5 categories in the first 24 hours of publication. So I'm very excited to have Wendie here, because her and I, you guys know, if you've been listening to me for a while, very similar stories here with the heavy metal and the toxicities and these unexplained issues. So welcome to the show, Wendie. Thank you so much for being here.
Thank you, Karen. It's great to be here. And can I just say, you're the most patient human being in the world for having read my entire bio and not skipping stuff. I'm amazed.
Oh
yeah, whatever.
Yeah. I oftentimes cut them short because some people will give me like a page and I'm like, oh no, I can't do that.
No,
but
and that's the long one. We have a short one. I was like, oh, she's reading the long one. God love her. So you get the Saint Award of the day.
Thank you. Thank you very much. Well, I loved your book. You're just speaking my language. I myself have suffered with heavy metal toxicity. It was interesting because I was reading in your book, when you guys, and we'll talk about this, but what you look for in levels in the test for a challenged heavy metal test. And you say anything over 8 on the lead is a problem, but definitely over 16 is a real problem. So I was like, I wonder what my levels were. I can't remember. And I went and looked this morning, 33. Not good.
You're an overachiever.
I know, right?
I always say to people, we're going to get you boring, because right now you're not boring. You want to be boring.
Exactly.
You're not
right
there yet.
But first, I want to hear your story, because I think, as I said in the intro, so many women nowadays have these unexplained health problems. I just had a girl yesterday who's like hair loss, can't lose the weight, has all these hormone dysfunctions. And I'm like, gosh, I am so sorry to tell you this, but I think you might have heavy metals or mold. And I'm like, it's such a, it's my last resort. It's like, I don't want people to have to go down this pathway if they don't have to. So I leave it to the last thing, but it's becoming more and more of a problem. So let's hear what happened to you.
My story has 2 parts.
Okay.
The first part is the part where I was born to parents who both gave me the worst genes possible. I said to them, I'm so grateful that you reproduced, really, because I'm here, but you should never have done it. You should never have reproduced, because I have the worst genes. I have 2 copies for all the bad stuff. So 2 copies of MTHFR, 2 copies for celiac, 2 copies for vitamin D deficiency. and I can't change that, but I'm like a genetic overachiever, whatever we want to call that. So part one of the story is being a child of the 70s, having lots of food sensitivities, but not knowing it because in the 70s, nobody complained. You just kind of went on with your life. And getting lots of antibiotics because that's what we did. I had lots of strep throat, ear infection. I had antibiotics at least once a year, if not twice. And by the time I was 15, I had sort of pan across the board nutrient deficiencies. And I was worked up, down, and backward. And finally just said, your periods are heavy, take some iron. So I did. So I stopped pooping because back then iron was like the worst.
But still.
However, it didn't fix the problem. I was still anemic. I was still low in all my minerals and nutrients. But at the time, I was never tested for celiac. So that's when I was 15. And again, it's the mid 80s. Nobody heard of celiac at that point. Fast forward almost 20 years, and I can barely get out of bed. I have head to toe issues, hair loss, brain fog, anxiety, thyroid issues, heart palpitations, asthma, bloating, gas, diarrhea, constipation, bloating, diarrhea, and constipation, sometimes on the same day, back to back, right? Like, who knows? I had fertility issues. I've clearly made up for them by having 4 kids.
4 children.
I had issues getting pregnant, bad periods, heavy periods. I had weight loss in a way that I was wasting. So I wasn't healthy. I was just really skinny, and my joints hurt, and I had mineral and nutrient deficiencies. So it's like head to toe sick. And the only reason I got out of bed and went to work every day was because I was the primary breadwinner at that time. And if I didn't do it, ain't nobody going to do it.
Right.
So I went to work. And when I had my second child, my husband took me to see his mentor. Neither of us had really fully gotten into functional medicine at that point. And he took me to see his mentor, who did what I considered to be a ridiculous workup on me, like crazy expensive. Yeah. And I was horrified. But it was my first foray into functional medicine. And he did the head to toe workup, and we're on the way up there. And I said to my husband, I can't wait. You have to ask him what the problem is. And my husband, being a good guy, knowing that I was out of my mind at that point, like, there's no way to talk me off that one. He called his mentor and he said, we're on our way, but Wendy's having some anxiety about this. Can you give us a heads up? And he said, she's not going to like the results. And I remember saying, do I have diabetes? Please don't tell me I have diabetes. I can't stick my fingers. I can't do it. And really, my heart goes out to people who stick their fingers, because it's such a courageous thing to do every day.
Oh, I know.
But I knew I couldn't do it. And he said, you don't have diabetes, you have celiac. And I went, oh, my dad has celiac. He goes, well, you have it too. And that's part one of the story, where I went gluten-free, got diagnosed with celiac, and my health started to transform. It was amazing. Now, the problem is when you take one problem away, it's like that row of shark's teeth. You often start to uncover additional issues.
Yes.
And so when I got rid of the celiac issue or the gluten issue, my brain fog cleared up. My hair started to grow back. My asthma went away. My anxiety went away. My gut got a little bit better, but not better like you would think. I still had bloating and constipation, no longer with that raging diarrhea. And so then the next cut of it was deal with the imbalance in the microbiome that had happened from 20 plus years of not being treated properly. Mm-hmm. So that's sort of part 1A, which was to work on the gut, which is the candida, the microbiome imbalance, and really work on the minerals and nutrients. So that was part 1. Mm-hmm. That happened when I was 35. So that was 16 years ago. I'm 51 now. And when I was 48, part 2 happened. So a couple of things happened in a short period of time. Now, 1, I became perimenopausal, which I think is cruel and unusual punishment for anyone. So that was not helpful. That's like being a toddler and being hungry and tired, It's now perimenopausal. And having said that, I don't believe that we're meant to just get worse every decade. So when it started to happen, I was like, oh, we got to fix this. So I started to work on that. But a couple of things happened in the span of a year. My neighbor took his post-war house down that I knew had lead paint. I knew it had lead paint. Yes. And I flipped. I didn't know it was happening. And I come home and my windows are open. It's dead of summer. And the house next to me is in dust because they're taking it down, and I'm freaking out. I'm like, shut the windows. There's lead paint in the air. Shut the windows. Turn off the air conditioning. My family's like, are you nuts? It's 90 degrees in Boston. We're not doing that. So I'm like going crazy. So that was one exposure. My hair loss accelerated after that exposure.
Oh, wow.
And I was like saying to my hairdresser, my hair's falling out. She's like, you're nuts. Everyone says that. I'm like, no, my hair's falling out. And every 6 weeks I said to her, my hair's falling out. And she's like, you're not falling out. And finally, like December, January timeframe, like 4 or 5 months later, she goes, okay, I think your hair's falling out.
Yeah.
And I was like, I knew it. And then I started to sort of sleuth in my brain, like, what could it be? What could it be? And I missed metals. I just missed it. I don't know. I wasn't thinking. Fast forward to April, we go to France, trip of a lifetime. I've never been to Europe. And we're slogging through all this dust in France. It was 10 days after Notre Dame burned. And I said to my husband, oh, we're going to be like, just, we have to sort of disinfect ourselves. It's so dusty. And then when I came back from France, I gained 9 pounds within the month. A month. Who wants to gain 9 pounds in a month? I flipped. And my hair loss accelerated even more. And I developed a rash on my face. And it was in the corner of my nose, underneath my chin, on corners of my eyes. And it got worse and worse every week. And I was like, what in the ever loving is going on? And I again, didn't think of metals. But at the end of the summer, I heard a report on NPR that when Notre Dame burned, it released 500 tons of lead dust in the air. Lead dust.
It was like out to get you, isn't it?
Seriously, I'm like a magnet,
Yeah.
Bring it on. I'll be loyal to you. So it came and I picked it up and brought it back to Boston. So I said to my husband, I just heard this report. I am sure that I got a lead exposure. And I know I got a lead exposure when my neighbor took his house down. And I have symptoms. So I did the test in September of 2018. And I had previously tested my lead and it was just a little bit out of range. It was 9 and our cutoff is 8. So at the time I blew it off. I'm sorry to say I blew it off, because the things I didn't know then that I know now is that it was really the tip of the iceberg.
Yeah.
And so if I had known then that 9 was the tip of the iceberg, I would have taken it more seriously, but I didn't know that. So I was like, it's fine. I don't have time to do that right now. I'll deal with it later. And then, all hell broke loose and I couldn't fit into anything. And I was like, okay, I'll retest. So my lead went up 25% from the first to the second test. And I was like, okay, clearly, it's not an exact science, but clearly something's different and I'm clinically different. So I started treating. At the time of the first and second test, my mercury was negative. So I start the program and I start to remove it and my hair loss slows. And I'm like praising the universe because it was
hair loss for a woman. Oh, you got the two worst things that will drive a woman to do anything to get rid of, which is hair loss and weight gain.
And then a rash on her face.
Oh, okay.
Terrible. Give me those 3 things, said no woman ever. So, thankfully the rash started resolving and the hair started growing back. I didn't lose the weight for a while. Actually, it was like it was the last thing. And
I've heard that.
And just as a disclaimer, I've been in this dance for now 2.5 years. And the weight really only came off about a year ago.
Yeah. I've heard it's like about up to 2 years of chelation before you'll see the weight drop.
Yeah. It takes a while. The body has to get back to its natural state. So I've been removing the metals. And because it was the tip of the iceberg, what I've seen is as I improve my body's ability to mobilize and get rid of, I've noticed the levels going much higher. So my initial mercury was negative and then it went up to 41, which is pretty high. And my lead got up to about, I think 30.
Yeah.
And so I've been systematically.
So explain that though. Like, why does it go from nothing to suddenly high when you're actually taking stuff to remove the metals?
Great question. So part of our removal process improves the liver's innate ability to get rid of toxins. Now let's back up a step. 1, don't be exposed, right?
Yeah.
Don't work with lead paint. Think of the body like a rain barrel. And as you're exposed to toxins, metals, pesticides, inflammatory foods, stressful lifestyle, not sleeping, all of that puts burden on the body. So being kind of I'm someone who likes to do hard things. And so I picked a hard profession and then I picked to go into startup world and be an entrepreneur. And so those are hard. I'm really meant to be someone who has like staff at my beck and call, eating bonbons, fruit-based bonbons all day, sitting by the pool. That's what my constitution basically says I should be doing, except my personality is like, let's go make a difference.
Yes.
So
and have 4 children.
Right. Have 4 children and have a couple businesses and let's go make a difference.
Yes.
Those don't
I
go
relate.
together, right?
Yes.
And then layered onto crappy detox. So as I mentioned, 2 copies of MTHFR, which means I don't methylate. If you don't methylate, you can't bind and get rid of your toxins. So there's so many layers to this story, right? So the tip of the iceberg is occurring and showing up that way because all of those things that go into not being a good detoxer in the first place, layered on top of stress and not doing for my body what it needed, layered on top of I'm a really good eater and I live in America. So it wasn't always organic. And sometimes I ate more processed food than I should. So you layer on those things and it makes it really difficult for the liver to do its job because it's just getting bombarded constantly. I got to deal with that. I got to deal with that. I got to deal with that. I did quit drinking about 15 years ago because I found that my recovery was so impaired.
Same.
And I really don't like the taste of alcohol unless it's like a sweet wine called Manischewitz, and that's not cool to drink. So I just stopped drinking. So that was in my favor because I wasn't asking the liver to do more. So there's all these layers that go into it. So I wasn't the best detoxer, and I got exposures as a child growing up in homes that had lead paint, having lots of mercury fillings. And when you're not the best detoxer, it just starts to build up and build up and build up. And so when I hit the tip of the iceberg, it was that way because my liver at that point was like, I can't deal with it. I'm not going to play that game. I can't deal with it. And what you have to do is retrain the liver, support it, allow it to start detoxing and moving things. Because if it phase 1 super fast, you're going to take your toxins and make them more toxic, particularly when it's your hormones. Phase 2, you take your toxins and bind to them from a methyl group, remember MTHFR methylation, and then put it in your gut. And so if you have any gut dysfunction, you're going to disattach your binders and recycle your toxic hormones, toxins, whatever it is that you're trying to get out. So there's a lot of layers to this, Karen, and I don't mean to go all over the place, but basically it didn't show the test result originally because my liver was pretty locked down. And until I fixed it and supported it, you couldn't see what was really there. And I always say to people, don't freak out. It's going to go up. 95 to 97% of people, they go up on their repeat test after treating. 3 to 5% go down. So you're unlikely to be someone in that little tiny group. You're more likely to be, it's going to go up. Don't freak out.
Yeah. So and so much of it is locked inside our bones and our brain and organs. And yes, that test pulls it out, but the chelation or the removal process is even longer. And so you start to pull these heavy metals out of these organs and tissues, and then the blood levels goes up.
Yes. So it's really important to make sure you're taking the binders so that you can bind it and get it out. It's important that the gut's working. You mentioned, I think, I'm not sure if it was right before we started or right after, but that you don't often go right to toxins because you do have to fix the gut. If the gut is dysfunctional, you will not get better. You'll get worse. So you have to do what I'll call the foundational work, which is the gut, the minerals, nutrients, the life, the food. That's your platform you stand on. And then deal with toxins. If everything you've done hasn't worked, then you deal with toxins. But you have to get the body well enough it's a stressful process.
Yeah. What was, do you think, causing the hair loss? Do you think it was that the exposure affected the thyroid again?
No, I think it was a toxic response.
Yeah.
I think it was a toxic stress response because we've found repeatedly that patients with high levels of lead will lose their hair. And so in fact, we have a patient in our practice who came to us completely hairless, like hairless head to toe. And I'm her gynecologist. And I joked with her like, hey, you don't have to do any waxing or anything.
Yeah.
You know, there's always an upside to everything. So I said, no, you don't have to wax. She's like, I know, that's the great part, but I also don't have any hair on my head. I'm like, I know, we're working on that. So she came to us completely hairless. And I just said to her, can you please send me a picture? Because she had to go get a haircut, actually her first one after her hair grew back because it grew back, which is magical.
Yeah.
So often people and she had really high levels of lead and mercury. So often metals will cause hair loss.
And did you reverse your thyroid problem? Because you said
Oh
you
yeah,
had
my
thyroid.
thyroid's perfect. No
What
meds.
had what was your profile, your thyroid profile? Was it that you weren't converting T4 to T3 or reverse T3 went up?
I never had a reverse T3 issue. I had elevated TSH and low T3.
Yeah.
And so at first I tried medicine, and I tried one of the porcine derived medicines and
Yeah.
went off the cliff, and then learned that people who have autoimmune disease often don't do well with,
Yeah.
with the,
With
and I was
armor.
like, oh,
Yeah.
well, I can vouch for that.
Yeah.
So then I went off medicine because it made me legit a raving lunatic. I mean, imagine like me hyped up on something even more. Like, this is how I normally am. Imagine me kind of jacked up even more. So that wasn't a good match. And then I tried acupuncture. I mean, getting rid of gluten was so impactful, but acupuncture, supplements to support the thyroid, ashwagandha, stress reduction, sleeping enough. So I
Yeah.
do my thyroid every year, and I was like, oh, my thyroid looks good.
Nice.
TSH is perfect. Free T3 is in the perfect range. Reverse T3 is perfect. No antibodies. I never had antibodies. It was one
Yeah.
thing I didn't have. Didn't
Yeah.
have autoimmune thyroid.
I think that the heavy metals are one of the biggest driving factors right now for hypothyroidism in women. Like, we're in an epidemic. It's like every woman I come across has some degree of at least subclinical hypothyroidism or straight on hypothyroidism. And a lot of it is in that conversion of T4 to T3. And I'm like, I think metals are driving this for myself. And for my listeners, when I was diagnosed with a thyroid problem, finally, like 5 years ago, I was like, okay, I've got the answer, right? And the practitioner I'd been speaking with that was helping me, he wasn't familiar with reverse T3 and wasn't familiar really about that whole conversion stuff. So he was like, yeah, I'll just give you the desiccated thyroid. And right away I was like, this is the best I have felt my whole life. Like, suddenly all these things went away and I felt so good, and I was losing weight effortlessly even though I was eating more. And I'm like, oh my God, this is the answer. Woohoo. And then like 6 months in, everything reversed, and I got super sick, realized my reverse T3 had been elevated and then went up even higher. And so then I went on the journey of, why do I have a reverse T3 problem? Why is my body storing thyroid? Why does it not want my metabolism to go up? What am I conserving here?
Right.
And so I had interviewed heavy metal experts. I had read the symptoms. I was like, I don't think I have heavy metals. I've got no mercury fillings. I'm fine. But I went and took the visual acuity test for mold. And it said, because I was just trying to like check off the boxes at this point. I'm like, what could it be? Right.
Yep.
Did a gut test. My gut was great. So do this next test. And it says, you don't have mold, but you are fighting something, possibly heavy metals.
That's not freaky, right? Like,
right.
What am I fighting?
Exactly. I'm like, what? So then I was like, I'm just going to do the heavy metals test just to say I've done it, and I can like put it away and not have to go back and look at it. And then lo and behold, as I told you, my lead's 33. My mercury was just right behind it. Second test, lead had come down, mercury had gone up, like you. And I'm still years into it, of the like on and off chelation and researching, and it just is like, I really feel like it's this huge missing piece that nobody really, like my sister, even I said to her, I said, we do come from the same background, sister. Like, maybe you should test your heavy metals, because I bet we grew up in old houses, lead piping, right? Lead paint. I said, you should go test. And she says, I can't. She says, I cannot go down that road. And I'm like, fair enough. Turn the blind eye.
Right. No, not until you're ready.
Not until you're ready.
Only do it when you're ready, because I try to persuade people like, oh, it's a pain in the butt. You got to get Google involved. It's going to tell you what to do all the time. It's expensive. Yes. And you're going to have to do it for like at least a year. So I don't know. Don't do this first. Do all the other stuff first.
All the other stuff first. Exactly. Yes. I would love for you to talk about how, because you're really big into like what your DNA telling us about how well your body can detoxify. And I think that that's a big thing, because with heavy metals, like I said, some people I think can get rid of them and they're not riddled with it. But it's like, how is it that some of us have these super high levels? And I think it comes down to the genes. So let's talk about the MTHFR and explain what that is. I think a lot of people, they know the word, but it goes right over their head. And even for me, it's like a little bit confusing. It's like, so talk to us about that.
Yeah, it's super common. So MTHFR stands for methyl tetrahydrofolate reductase. And now, having heard me say that, you know why we call it MTHFR, because it's too painful to say that all the time. And what it's representing is your ability to methylate your B vitamins. Okay. And the reason this matters is, well, let me back up. Your B vitamins, when methylated, they have this methyl group, and the methyl group is what you're attaching to a lot of the toxins and hormones to bind to them in order to make them water soluble, so they leave your body via your stool, usually your stool, but also your urine. Okay. So when you have MTHFR, you can get 2 different types of mutations, and you can get 1 copy from each of your parent. So you can have 2 of one, 2 of another, or a mix, which is called compound heterozygous. Okay. So if you have 1 copy of either gene, your ability to take your B vitamins and make them methylated or active, ready to contribute, is impaired by somewhere between 30 and 60%, depending on you and your life and your stress and all that. If you have 2 copies, your ability to convert your B vitamins is impaired by 80 to 90%, which means if you could take a bath in B vitamins, but if they're not activated, they're not going to give you what you need. And because your body's not able to make what you need, it then has these downstream consequences of, you can be fatigued because your B vitamins are not proper, and specifically B12 and folate are the 2 that I'm talking about. But it's endemic. It's really, those are the big ones. Because, and when you have this MTHFR mutation, your risk of cancer, heart disease, psychiatric disease, diabetes, all go up. Each gene has its own sort of sweet spot, but they both basically increase your risk overall. And they make you not able to detox particularly well. So it gets very complicated. There are people who spend their entire careers talking about MTHFR. Yeah. That's like the high level. It's important because if you don't have the ability to activate your B vitamins, you won't be able to donate that methyl group, methylate, and get the toxins out. And let's be specific. Homocysteine is a substance in your body that you want to be on the lower side. And the reason is that as it gets higher, your risk of cardiovascular disease, heart attack, stroke goes up. If you don't have the ability to make activated B vitamins, you can't process homocysteine. So I've seen patients with homocysteine levels that are ridiculous. And I've said to them, and simultaneously have levels of B vitamins that are so low as to be practically undetectable. And I said, you might have an innate issue with homocysteine, but I think what you have is a tremendous deficiency of vitamin B12 and folate. So let's get those on board and see how you do. And the patient I'm specifically thinking of, her homocysteine started at 65 and she's 80. So I read her the Riot Act. I was like, your risk of cardiovascular disease is super high. You got to get your act together. We got to get these numbers up. And simultaneously her vitamin B12 level was like 65 and you want it at 750-ish. So she was so far outside normal. I started on B vitamins and I rechecked her in 4 months and I was like, oh, geez, you're an amazing responder. Because she came down into normal range, which is just unprecedented. So these are really critical for things that are going on in your body every moment of every day. It's occurring 1,000 times a second. So it's really the body's need for vitamin B12 and folate is quite high. Activated. Right. That way activated.
If on a blood test and the person's not supplementing, if their B12 is over range,
I don't really care.
That doesn't matter. Okay. Because I wondered if I'd heard like because you might actually need other Bs to process the B12 better. I've heard, but
it's funny. We're usually giving people a complex, so we sort of
yeah,
like avert that. But
yeah,
B is a water soluble substance. And so it's not going to build up inappropriately in your body.
right.
Now, you could take too much and have just really expensive urine. You can
Yeah.
have valuable urine, but doesn't make me too crazy. You can also check methylmalonic acid to see what's happening in there, what's really going on. But a straight up high B doesn't worry me the way a low B is going to worry me.
Right. Explain phase one, phase two, because everybody goes out, it's at the time of this recording, it's January, it's detoxification time. So
Yeah.
everybody's like, let's go, start detoxing our liver by taking some milk thistle, or they just go to their local health food store and they're like, oh, I'm going to do my 2-week liver cleanse. And I have yet to really find a good one that's in a store that really addresses phase one, phase two, and even phase three. So let's explain these two phases and why they can get bunged up. And
yeah. So the easiest way I find to explain phase one and phase two is centers around hormones, actually, because it's a really clear process that happens. So for women, and forgive me if you want me to go bigger field, I can, but it's just such a great way to explain it.
Yeah.
So women make hormones, and those hormones need to be processed to leave your body. Now, phase one in the liver takes that hormone and makes it counterintuitively more toxic. Go figure. It's an extremely fast process. Particularly in women, phase one is very fast. Phase two takes that toxic hormone and binds it to a methyl group. This is how MTHFR is important, because it's giving you the methyl group. So when you have your hormones are fat soluble. They cannot be in your gut because your gut is water, or in theory should be water, not fat. So you can't directly just put your hormones into your gut to get rid of them, because you have to bind them to a methyl group. That makes them water soluble. Okay, it makes them inert, water soluble, and you put it in your gut. This is why it's so important to make sure you have good gut function, because if you don't poop, there's an enzyme in the gut, or even if it's overly active, it's called beta glucuronidase. It's all throughout your body. But in the gut, what it does is I think of it like a barbell. You see this hormone and the binder. It's bound together. That beta glucuronidase comes by. Now, I wish I had 3 hands so I could show.
Yeah.
Here's this and this. It cleaves right down the center of the two of them. When you separate the hormone from its binder, when you bound it in phase two, it becomes instantly fat soluble again. It's no longer water soluble. It goes back into your system. Your liver's like, dude, I just dealt with you. I don't have time to deal with you right now.
Yeah.
And it stores the toxic hormone in your fat, and until you can get to it. So because phase two is on the slower side, what you want to focus on are things that improve phase two. Now, just as a disclaimer, this is the part where vegans go nuts, because a lot of things that help phase two are flesh. So eggs, fish, chicken, poultry, meat.
Meat.
Yep. It really does help phase two. It's harder to, not impossible, but harder to get effective detox really ramped up if you're on 100% vegan eating plan. And it's not impossible, and I don't want the vegans to feel left out. And it does often call for flesh to improve phase two. There's a lot of things that you can take to improve phase two. Milk thistle's not bad. I mean, there's lots of things you can get online that'll support it. I mean, you can even on your own do cilantro and parsley. These are improving phase one, but all detox leads to more detox. So there's nothing bad about it. It's simply, you want to you can do the things from the stores, and you want to make sure that you work with someone, right? Figure out what the problem is. What are you treating? And let's talk about that one thing you mentioned about that 2-week detox versus all detox is good detox as long as it's not making you sick. But you want to distinguish in your brain, are you doing a reset and doing a week-long cleanse to sort of get back on track? Or are you ramping up your ongoing detox that is a everyday type of ongoing behavior? They're very different goals.
Good point.
The cleanse is not going to be sufficient for detoxing you. It's going to be great to reset you and get you back on track. And if you're going to do that, then if see people are like, oh, I'm going to do a juice cleanse. I'm like, great, but don't you're in Canada, I'm in Boston. It's similar. Don't do a cold juice cleanse in the middle of winter.
Yeah,
It's
right.
out of sync with the earth. If you're going to do a cleanse in the middle of winter, do a bone broth cleanse, because that'll get you the collagen, that'll get your system working, but it's not cold. It's not jarring the system. So try to be in sync with the earth, and it's fine to do a cleanse anytime, but just understand it's not a detox, it's cleansing.
Mhm.
It's resetting.
And the reason why animal protein is so good for phase 2 is because of the amino acids in it. So can people just take amino acids for that phase 2 then?
I believe so, but I usually say, go see my nutritionist and she's going to get you set with that.
There's so much you can do through food. And I think I believe you got to do the food and the supplementation. So I use the amino acids, but also with the foods like cruciferous vegetables and meat. People always think it's liver cleanses should be no animal protein.
No.
And I'm like, oh no, this is when you want your animal protein.
Yes, as long as it's good quality animal protein,
right.
100%. Because what the animal eats determines the quality of its flesh. And so you want to eat animals that have been given what they need, so that the quality of their flesh and what was her name? I forget her name. Temple something. She figured out that cows on the way to slaughter, if they're stressed, the meat's worse.
Yes.
It actually spoils the meat.
Yeah.
And so you want to make sure that the animals are cared for in the way you would care for your family member, because you're eating that. So you want to put into your body something that's high quality and been well taken care of. The quality of the food matters.
Yeah, the beef I buy, the woman actually specifically says, like, we don't brand our cows when we kill them. When it comes time for slaughter, it's done in a very ethical way where they're not frightened. And I think that that's key. Yeah, I think it's very important, not even just for the animal, but for us too, right?
Yeah, exactly.
So when it comes to phases of detoxification, and I was looking at my own DNA report, and there's different systems, detox pathways, detox pathways. There's conjugation, acetylation, methylation, and oxidative protection. SOD2 is the SNP on that one. My worst one was 100% red, was the oxidative. The other ones some were good, some were bad. Out of these pathways, is there a pathway that heavy metals tend to, like, so for me, like, I don't have great oxidative pathways. Is that a pathway that heavy metals tend to go down and to be detoxified through, or does it not work like that?
You know what, Karen, I don't know the answer to that, and I would need to look that up.
Yeah. I bet you probably nobody really knows the answer. But I would think that they would all have a part in getting rid of these environmental toxins.
Yeah, let's go to the 10,000 foot view and say those pathways are there for a reason. And so whatever's impaired, you definitely want to support it so that you can optimize your body's ability to do what it's supposed to, because the body wants to be in balance.
Yes.
The body does not want to be out of balance. It really is trying. And so what you want to do is, like, that platter of what you can provide your body so that it can do its job, give it everything it needs. So I don't know the answer. And I would say I'm sure it has a role, because that's why it was designed.
Yeah, exactly. And so it's good to support all those pathways, I think, and get your DNA report so you know which ones you should be favoring. Like, we do so much guesswork, and we're, I'm going to take this supplement because so-and-so told me it was good for detoxification. And it's like, but you could be saving a lot of money because maybe you don't need that. And actually, like me, I need antioxidants because I'm a horrible oxidizer. So I need to prioritize that.
Yep.
And so test that too. It's so great to test, I think. And the prices have come right down too when it comes to DNA testing. So it's definitely something that should be on somebody's test list that they eventually have done. I think it's an important one to do.
Karen, I think this is an awesome point to say, let's distinguish what you do alone versus what you do with a functional medicine provider, because you can do a cleanse on your own, no problem. You can improve how you eat on your own, no problem. You can tinker with your eating plan, not a problem. And just so you know, I don't use the word diet because it implies something temporary. And I'm always consistently looking for a long-term sustainable solution that's going to work for people over time. And
Yeah.
diet, the word itself just gets my goat. So
Negative connotation.
yeah, it really does. So I'm always talking about like, what can you do that you can sustain and that works for you and feels right?
Yes. Perfect.
So you can tinker with how you eat. You can eliminate categories of food to see how you respond. You can substitute most supplements without problem because you're not going to harm yourself. There's 4 minerals that are fat soluble that would build up in your body if you got too much of them. A, D, as in David, E, and K. So those are the 4 that you don't want to just indiscriminately take because you can build up too high. Now, the general population, especially if you live in the north, is not going to build up too much vitamin D. So you can pretty safely take kind of whatever's over the counter and not have a problem.
Mm-hmm.
Where you run into problems where someone said to me, oh, I'm taking 20,000 IUs of vitamin D a day. I'm like, let's check your level. And her level was over 100, which I never see. And I was like, let's back it down.
Yeah.
It's a little bit high. And even, I was like, 20,000 a day is a lot because you're not in like the North Pole. So you can pretty safely take pretty much anything that's over the counter. There are some things that I recommend you be careful of. Berberine, if it's not sourced well. I don't recommend you take anything that's hormonally based, like pregnenolone, DHEA, unless you know the source of it. And then certainly A, D, E, and K, or especially D, because it's so common, you're going to want to work with someone. But you can do a lot of things on your own. And then the things you want to get support, don't be an island for, would be if you want to do any true deep evaluation of toxins, you're going to want to do that with a functional medicine provider.
Yes.
If you really need to drill into the microbiome and what's happening in the gut, you're going to need a functional medicine provider. Yeah. If you want to drill into what's happening with your antioxidants and what are your levels and what are your specific Bs that you're high, low in, you're going to need a specific provider. If you want to be data driven, you'll need to work with someone. If you want to, but you mostly won't harm yourself with most of the approaches of, oh, I'm going to try what happens when I do or don't do this. You probably won't harm yourself for most of those options.
But you'll harm your pocketbook.
Yeah.
Right. Like free. That's the thing. People think, oh, I can't afford testing. It's like, yeah, but how much money have you spent on supplements and programs that you're doing online that you're just willy-nilly, it's like, oh, this supplement looks good for detox, so I'm going to take that. And it's like, no, that didn't work.
Yeah. And actually you bring up such a great point, because I always say to people, the Great Wall of China was not built in a day, and you are not going to be detoxed in a day either. And so you don't have to do the entire test for all the toxins. I was talking earlier with a group and I said, look, the whole toxins testing, if you do it up front, it's like $750. That's a lot of money to do all at once. Mm-hmm. But you can break it into chunks. You can break it into 4 separate chunks. You might pay a little bit more because you get a discount for bundling stuff, but so you might pay a little bit more in the long run, but in the short run, you're not assuming the costs all at once. It's much more manageable. Mm-hmm. And because you can't deal with too many protocols at once, you can't, it's really, I do it because I'm the poster child. I kind of have to do it, right? So I deal with my mycotoxins, my metals, and my environmental toxins all at once. But in reality, it would be much easier and both on your pocketbook and your lifestyle to deal with them sequentially, one at a time. Yeah. So you don't have to test all at once, and you don't have to deal with it all at once. You really can break it up, and that makes it a lot more manageable.
Yeah. What are the tests that we should be taking then? When you say there's 4 tests that you like to do for toxins, what are those tests?
I might have to add a 5th because.
Okay.
So if you have mercury fillings and you want to know whether the mercury fillings are impacting your health, you want to do the mercury test by Quicksilver. I never did that test.
I didn't either.
I should have, because I have mercury fillings and I was extremely reluctant to get them out because I just couldn't draw the line between something that was 40 years old and impacting me now. Now that was stupid. I should have totally done that. Okay. No, like, look, here's a disclaimer. You're going to screw stuff up when you go on the detox journey. I'm the poster child of have a sense of humor about it, fix it, and move on. So my fillings are coming out next month. and I have 4 left. I've had a bunch out and I have 4 left. And what the biological dentist said to me was, look, every time you eat or brush your teeth or drink anything warm, you're releasing mercury into your system. And I was like, oh, bugger. So do the mercury tri test if you have fillings to see, is it impactful? I never did that. That's one test. My other test that I recommend is a urine test. By the way, the tri test is blood. The urine test I recommend for metals is a pre and a post. You want to get your baseline, make sure that there's nothing really exposing you in your environment. And this is really, truly old. So you do a baseline urine, and then you provoke the metals to come out with DMSA and look at the result. And that's a time test. It takes we do 6 hours.
Mm-hmm. And DMSA is a agent that you use to remove lead and mercury.
Correct. And other, I mean, it binds to lots of metals and it increases the removal of them. So you test and see what you have. So the test we use is doctor's data. I think it's $69 for each test. And then the DMSA comes from a compounding pharmacy. And so they charge like $30 for the pills that you need. So that's for the metals. And then are you okay with I say like specific brands? I should have asked you.
Please do. Yeah. I used doctor's data, never did the Quicksilver, but I've done doctor's data twice now, the pre and post.
I'm surprised. I kind of want to ask them for a discount because I do it so many times a year that I'm like, why aren't I getting a discount on my test? It's like, a volume discount. I'm on my 4th test.
Right. Yeah. Because here in Canada, I paid just over $200 for it, but I've had several people tell me that their practitioner was charging them $400. And I said, get doctor's data then, because they weren't doing doctor's data. Seems to be the least expensive.
Yeah. I mean, we choose not to mark it up. Some providers can mark it up. We just pass it right through. We don't even charge it. We say to the patient, when you send it in, here's the cost.
Wow.
And then my favorite testing for other, which includes mycotoxin, plastics, gasoline, construction materials, beauty products, all of that, styrene, plus the herbicides, pesticides, insecticides, is through Great Plains. That's my favorite test. And that is a urine test.
What's it called?
Well, there's 3 components to it, which is why I'd said you could break it up. So one component is mycotoxins or mycotox. One component is GPL tox. That's the other environmental toxins. And then there's the glyphosate specifically glyphosate. And you just check them off on the requisition form. So it's great. Okay. And that, if you do it all at once, that test on our end is $537. And that includes a $60 discount for bundling it. I know, right? That's $750 to do this if you do it all at once. So if you deconstruct it, it's $299, $199, and $99, but they give you a discount.
And you could do that visual acuity test. It's very strange. Did you ever do that one, Wendy?
I did it. Yeah, but I have mycotoxins. So I was positive. You
did. So it turned out, it's apparently 95% accurate. It costs $10 online. So that's, if I suspect mold toxicity, I'll have my client do that first, because I'm like, look, the mold test is not cheap. I think in Canada, it's $500 just for mold. Ouch. So I said, go do that first. If it comes out positive, then spend the money and go find out exactly what's happening and work with a practitioner that can do, proper removal of it too.
Yeah, exactly. Yeah. So the other thing people can do is European whole body thermography, which can sometimes indicate toxicity. I've had patients come to me and show me the report, and I'm like, oh yeah, that makes sense. And we already knew the data, and then they went and got the thermography. So that's another possible way that people can do it, but that's not cheap either.
No,
but I
never heard of that.
Oh, it's great. It uses temperature variations to look at inflammation, imbalances, toxicity, and it's a screening test. A lot of women here use it screening for cancer, for breast cancer.
Yes, I've heard of it for that.
Yeah, but you can do whole body, and that'll screen for potentially toxicity or imbalances. So that's another option.
Okay, so is that the 5 tests?
That's just no. It's the tri test, the metals, the
Great Plains.
The Great Plains is 3 in 1. So
okay, so that's the 5. Okay, got it. Okay, now when somebody then has these tests done, I remember I asked my naturopath, because I thought I was like an exception to all of this, right? I was like, how often do you see this? And she's like,
all the time.
all the time. I'm like,
Yeah.
oh, I said, so there's a lot of lead and mercury and all these other things in our environment, everywhere at all times. She said, all the time. And I was
Yeah.
like, oh, that's crazy.
Yeah.
Once we get that report back, some people do hair mineral analysis, which I am like, I think it's a good one if you've got mercury fillings, because you're not going to be pulling the mercury out of your teeth when you're doing the chelation, the removal part.
Right. Right.
But you have to have somebody that knows how to interpret it. So you got to work with a practitioner once again.
Yeah.
Don't just do it on your own, because your results are going to show that you don't have any toxicity, likely because hair only shows 3 months worth.
Yeah, I'm not a huge fan of the hair because it's also not provoked. It doesn't
Yeah.
show what you've stored. The
Right.
issue is most of us are storing much more than is floating around.
Yes.
And that's really the biggest concern. So I'm not a huge fan of hair. It's not bad, but for people who refuse to do any type of provocation, it's great. You know, if they're like, I'm not doing the provoking test, I'm like, okay, well, let's do hair then.
Yeah. And then have somebody that knows how to interpret it, because metals will affect the minerals in the system. And so if somebody knows how to interpret it, they can say, it doesn't show that you have any current exposure in your blood, but your minerals are deranged. You likely have mercury.
Right. Thankfully, they're not saying you're deranged, right?
Yeah. Although you start to feel deranged with mercury in your brain. So let's talk about what a person can do, or what you do, even just in your, like, what is a practitioner going to do for somebody when they come up with these positive results? How did you personally get rid of your the lead and the mercury? Mostly the lead. What were you using? Because there's so much controversy about what to use and what's safe. And so I'd love to hear how you did it and then what you guys use in your practice.
Sure. So I am still a work in progress.
Yes. But your lead's come down, which is good. Lead takes forever to get out.
Yeah, the lead's down. I'm still working on the mercury and I am getting my fillings out next month. And I really am very hopeful that that's going to move the needles in a meaningful way. So what I use, so I work in a functional medicine office. I own the office. So I've been lucky because I can, it sort of sounds funny, but it's like the cobbler's kids are never shod, because I'm always working. And so I haven't gotten as many IVs as one would expect, given that I work here and have a nurse 10 feet away.
Yeah.
So I said, in an ideal world, well, I won't tell you about that. I'll tell you what I did. So what I've done is, I would say over the past 2 years, I've gotten approximately 25 IVs. So 1 IV a month-ish on average. When you sort of aggregate, maybe it's 35. You know, it's like, because I go through fits and starts. I had IVs twice a week for 8 weeks, but then I was like, I cannot maintain this. This is just ridiculous. So I stopped. So it ebbs and flows. So I would say I've probably gotten about 35, 40 IVs over the last 2 years. And I do that alongside an oral program that we've designed. It's got 3 components to it. One component is designed to improve the liver's function. Now, before I tell you that, the years of celiac, part 1 of the story, left me with some residual difficulties absorbing minerals and nutrients. It's just sort of residual trauma from the gut that I've been untangling. But as a result, I take a lot of supplements to maintain my good levels. And I check to make sure that I'm at a good level. So I take a lot of things that support detox ongoingly. So I do things that support the mitochondria. I take all the antioxidants, the B vitamins. I take things to support the adrenals. So I do all that, all that stuff. And I simultaneously don't drink alcohol. I don't smoke. I don't use any marijuana products. Those are also excreted through the liver and metabolized through the liver. And I don't eat processed food and sugar. So I'm trying not to challenge my body as much so that it's not busy. I try to get enough sleep, I really prioritize sleep. And we have a sauna, an infrared sauna, and I go in that and have for about 14 months every night for an hour every day.
Wow.
Clearly I was a hot, toxic mess because I'm not perfect yet, right?
Yeah.
That's
a lot of saunaing.
It's a lot of saunaing. And I still stink when I come out, I'm like, wow. Oh man. But it's so funny because I'll just probably overshare, knowing me.
Yeah.
But the initial way I smelled in the sauna is different than how I smell now. And I've been tracking what are the chemicals that are in my body that I have. I'm actually due for a retest because it's just so interesting to watch as the smell changes, so does the chemicals that are showing up. It's just interesting.
Yeah.
So those
Yeah.
are all the platform things that I'm doing. And then layered on top of that is I do substances that support the liver's ability to detox. So that's glutathione, NAC, alpha lipoic acid, and vitamin C. So I do those. And this is where you want to work with a provider. So I'm not going to give you like how much I take and the
No.
dosing because
Yeah.
I really feel like people should be working with someone.
Agreed.
I'm taking 2 substances that bind metal. So a silicone base, it's a silicone binder, and EDTA. Those are oral. And then simultaneously, I'm replacing the minerals and nutrients that get pulled out. When you do this, you pull out your minerals and nutrients. So I'm replacing all of those with zinc and magnesium and manganese and all the trace minerals. So we're doing all that. So it's like a 3-part program, and it lasts 8 to 9 weeks, depending on how impatient I am and when I need to retest. This most recent round I did, actually, I think I did like 13 weeks and then said, okay, it's time to retest. And on top of that, I do something called oral DMSA, which we've referred to. I do a smaller dose of that every day on the days I do treatment. And on top of that, I'm also doing my mold treatment because I like to think in my brain that they synergize and they encourage each other
They
to
do. Yeah.
work.
Because I think the mold can hide underneath the metals.
Yeah. So I'm doing all of that. So I do intermittent fasting because I get up, roll out of bed, take the mold treatment, wait 2 hours to do anything else. And then an hour later, do the DMSA. So I don't eat until 11:30 or 12 most days because it's just not enough time to get things in before that. Otherwise, I can't get everything in. So those are the things I do. And then when I'm able, I get the IVs, which have EDTA and DMPS. So I layer those on. And the lead's almost gone.
Yeah.
The mycotoxins have come down. I started with 4 strains. Now I have 2, both of which are significantly lower than they were. The lead's come down. The mercury has come down and plateaued. So I'm a work in progress. We'll see about
with
that.
The mercury. Yeah.
The glyphosate I never had, which was amazing.
Yeah.
It was one thing not to have.
Because most people have that, don't they?
Yes. Yes. A lot of people do. And then the environmental toxins have pretty consistently been moving, it's just very rewarding to watch, especially when placed against that the mercury is not moving the way I'd like. It's like, okay, well, something's moving, something's working. We're getting the system back up online. And so you put that all together. And I mean, there's a lot that I do. My day is organized around detox, basically.
Wow. Yes. I feel the same way. Are you taking them every day, the supplements, when you're in a phase of detoxification, or are you doing like the 4 on, 4 off, 10 on, whatever it is?
I do Monday through Friday on the metals protocol. I do 7 days a week on the mold, and I try to do the sauna every day.
Mm-hmm.
And the platform foundational behaviors I do every day.
Yeah.
So it's the metals I tend to do during the week because my schedule is much more clearly mapped out during the week than it is on weekends because I have all these kids, I'm like, oh, I forgot to do that. Oops. So I don't really do much on weekends except for the mold because I roll out of bed and do that. And then I tend not to eat till later anyway. So it works.
So one last question.
Sure.
You're a gynecologist. What do you see? Like, how are all these things like the heavy metals and the mold, how do they affect our hormonal balance?
Great question, Karen. So think of it like, how am I going to language this? Think of it like there's a door, and behind that door think of it like you're in a concert hall and there's one exit and everyone decides they want to leave at the same time. Okay.
Yes.
That's all the people are the hormones and the chemicals and the toxins, and that door is the way they get out of you. Okay. So when your body is busy dealing with 1 or 2 toxins, it can't deal with the other things it needs to deal with. It's distracted. So it can absolutely throw off hormone balance, because if you think back to early in our discussion, when we talked about phase 1 and phase 2 in the liver and how it relates to hormones, well, your body needs to do that for toxins too. So depending on, essentially your liver is like the firefighter going, what do I need to deal with? What do I need to deal with? Oh, I need to deal with this. So whatever's the most pressing, it'll deal with. Everything else, it sticks in storage, which we know is fat. Liver knows is just stick it somewhere, or bones, stick it somewhere to get it rid of it. So it's not floating in the bloodstream, but it's out of my face for now. It's essentially prioritizing what it can deal with. So when you have significant numbers of toxins, you're most likely also going to have hormonal imbalances. And when I say hormone, I mean female hormones, male hormones, adrenal hormones, thyroid hormones. I mean, there's a lot going on in the endocrine system. And so the liver is responsible for being the gatekeeper for how a lot of that gets managed. And it will throw off, particularly for women, their female hormones.
Yes.
Because it's not a priority to deal with your female hormone when you have a bigger fire occurring. It takes a back seat.
Right. Yeah. Have you read anything about whether or not lead, I think maybe mercury too, can sit on the receptors sites for hormones like estrogen?
I have not.
I think it was Dr. Pompa talked about that.
Yeah, it's not beyond belief because it's so disruptive and inflammatory to the system. So I would believe anything you told me.
Yeah.
Around what lead and mercury do, honestly, because it's so disruptive.
Yeah, I know that mercury has an affinity for the thyroid, and we'll glom onto that. But it was so long ago that I heard this, and I think it was from Dr. Pompa, who's a heavy metal expert, and he was saying that, like, maybe that it's a xenoestrogen type thing, lead. Really? And that so that it'll sit and block the receptor site so you don't get your estrogen, basically. And so you can go into menopause sooner. And I always have thought, I wonder if that's why I went into early menopause.
We certainly, for women,
like, it makes sense.
Ovarian failure or premature menopause, we're certainly looking at toxins. So it makes sense.
Yeah, there you go. Sense. Right. Yeah. Interesting. Oh, I could just talk about this all day long, Wendy, but I will respect your time. Anyways, your book is fantastic. I love that you really make a point of being a very holistic approach. You know, your background as a gynecologist. Usually it's quite tunnel vision, right? Like, here's your medication,
right?
Right? Yeah, exactly. You're just looking up that tunnel all day long.
Yep. Just a little.
But you're really into the functional side of things now, and you're really looking at everything from this really bird's eye view and going, okay, as a woman, how stressed are you? What are you doing in your life? You know, what's your toxic load all around? Not just, but emotional toxic load too, you talk about. And I think that's so important. Sleep, all these things that people don't want to look at it. They just want to be told, here's your pill, take that. It's like, no, you got to address all of these things. And your book is really good for showing people, okay, women specifically too, like we're very overrun these days. Like you say, you got 4 kids, you've got how many businesses, and same with me. It's like, we're juggling a lot. And so it can really, it can harm us as far as our detoxification abilities go.
Yeah, I would say it's very difficult to do detox or if not impossible, if the body's in a state of fight, flight, and freeze, because what it's going to prioritize at that point is survival. So I always say to people, detox isn't a survival behavior. Detox is a thriving behavior, and you're not going to do it until the body feels safe and cared for. So you need to sleep. You need to deal with that toxic relationship. You need to offload things that are not working for you. You need to handle your life. You need to eat properly. You need to sleep. You need to do these things. Otherwise, you can't get to the next level. You get stopped and you don't detox. And then you feel like crap. And then you yell at me because you don't feel well.
Yeah. Yeah.
So we have to get you feeling well. The goal is feeling amazing. So handle the platform, and then you can start thriving.
Yeah. I mean, I think we all do this where we try to take the fast route, like I did with, just give me the hormone, just give me the thyroid medication and I'm going to be great. Nope. And then it was like, okay, I can't just keep taking medication in hopes that this is going to solve my problems. It's like, no, I guess I have to go the slow route.
Yeah. and it's frustrating, honestly. And
Yeah.
for women, it's all about the weight. And I say, I know
Yeah.
for you, it's all about your weight. And I'm going to tell you, it's not about your weight, because your weight is the barometer that tells me your body's out of whack.
Yeah.
And only when your body feels safe and cared for and well balanced are you going to start losing the weight. And it's going to take so much longer than you think it's going to take. And you're going to be ticked off at me. But the weight's going to be like the last thing to budge, because it was the first thing to go out of whack. You gained your weight and gained your weight and gained your weight and gained your weight. And then you're like, oh crap, something's really wrong.
Yeah.
And it's the last thing to fix. It's like that inventory management, first in, last out. That's how it is. First in, first problem, last to fix.
Yeah. I always say that too. I'm like, even for myself, I remind myself constantly, don't bother trying to like lose a weight right now, because it's not going to happen. I could go down to 500 calories. Nothing's going to happen.
Right.
Because I've got these toxins.
Yeah. I remember at one point in my process, it was about a year ago when we were writing the book, and they said, take a picture. And I was like, I can't take a picture, because when I pull my hair back, I have hair sticking out everywhere because it was all growing back.
Wow.
And I was like, I can't take a picture because it looks so terrible. But then I was like, oh, I should take a picture. And I never ended up getting it because it just never worked. But yeah, that work in progress stuff can be difficult, but the weight drives women nuts.
It does. And it's, they want to just get it off. And it's like, well, just tell me what to eat. Tell me what diet to do. And I'm like, oh, I'm sorry.
Yeah, no,
not going to happen. Like, you need to eat well, but you need to get rid of these heavy metals first, or else nothing's going to happen. Oh yeah. It's sad, but true, everyone. Sad, but true. And I have to tell myself this all the time. I'm like, dang it.
Yeah.
Well, Wendy, everyone, her book is so worth the read. Dirty Girl. You can find it on Amazon. It's wonderful. And you can find Wendy at 5journeys.com.
Yes,
I love that name.
It's all about our approach to healing, because it's your physical body, your chemistry, your emotional, psychological, your social, and your spiritual pillars of health.
I love it.
We called it that those are the 5 journeys you take that are all intertwined. So we called ourselves 5 journeys. And actually, Karen, I didn't want to forget to mention, I have a gift for your listeners.
Yes.
Because we have a free guide. Well, it's actually not free. It's paid, but for your gift, for your listeners, we'll make it free. And it's a guide that helps people walk through, like, how are they going to start detoxing their life? Because that's what our book is all about, is detoxing your life. And we've gone through, what's the best mattress, and what are great beauty products, and what's good pans to use, and furniture. So it's at 5journeys.com/promo, PROMO, and that'll get them the free detox guide.
I'm going to write this down, and then I will put it in the show notes, everybody.
Thank you, ma'am.
5journeys.com promo. Yep. Yep. Okay. Extra.com in there.
5 is spelled out. It's
it is.
FIVE. Yeah.
I didn't think it was. For some reason, I had it in my brain that it said just 5, but it's on the title on your website. That's just the 5, right? Yes. Okay.
Yes, our logo is just the 5.
Because can we not put numbers in a .com?
You can't. We do own 5journeys.com with the number, but I don't know if it's going to I don't think that 5journeys.com/promo exists. So
okay.
It just forwards to the real website, but then you're going to be stuck in the loop of like, where is it? So
yeah, right. Okay.
Spell out 5.
Great. Well, thank you so much for coming on the show. It's been awesome.
My pleasure. Thanks for having me, and good luck to all the listeners who are really working on this. It's hard work. It's good work.
Yes. Yes. Get a practitioner.
Yes. 100%. Second that.
Yeah.